African Policy Week has evolved out of the South African Drug Policy Week in previous years. I think that what we're seeing this year is we're seeing a renewed efforts by certain activist organizations to try and ensure that we move towards the decriminalization of people who use drugs. I was very pleased to see that the UN Rapporteur on Human Rights actually made a statement on World Drug Day, which is normally marred by things like executions of drug dealers. They actually called for the end of the war on drugs, which is really fantastic. I would never have believed that we would be in a situation where government bodies such as the Central Drug Authority, the South African National Council on AIDS, were calling for decriminalization, and that's what we're seeing. And so I think African Policy Week is a chance for people from West, Southern and East Africa to come together to discuss these, what were once radical ideas, and bring them into the mainstream and talk about things like decriminalization and stopping the very punitive drug policies that we've inherited largely from the United States in the form of the war on drugs, which in reality is a war on people. We're very fortunate that we've got representation from the African Union here. We've got people from several African countries, and some of them are policymakers. We've got active engagements with members of parliament from Kenya and Tanzania, and obviously the Eastern Southern African Drug Policy Commission is also involved. We heard South Africa's former president speak today. So this is really just a catalyst for the conversations, and we're going to approach it the same way as we did in South Africa, through relationship building. I welcome you to the 2023 Africa Policy Week. The event has got a history. It is known for sparking change, but we felt that this year there needed to be something different, something more local, something more African, because it's all good and well to hear about best practice examples from overseas, but we have a particular context which a lot of people don't understand. They have not lived through it, and we need to address that. We need to find solutions which are suitable to our context, to our people, which are driven by motivation from the community rather than imposed. Now it's time to do something which I never thought would be possible, which is to welcome former President of South Africa onto the stage at a Policy Week. This really is amazing. Thank you. So Your Excellency, Kgalema Motlanthe, thank you so much.
Thank you very much, Sean. Anything is possible. It always seems impossible until it is done. Madiba taught us. It is an honor and privilege to be invited to participate at this 2023 Africa Policy Week as we place a much needed focus on our beloved continent of Africa. As a member of the Global Commission on Drug Policy, I share the commitment of the 29 members working to inspire better drug policy globally, moving away from prohibition and advocating for policies based on scientific evidence, human rights, public health, and security to effectively leave no one behind. As members of the Eastern and Southern Africa Commission on Drugs, we believe that reshaping our little part of the world for human dignity goes hand in hand with better policies that use compassion and science as navigators through hardship, and that reduce and not produce harm in the process. It is commendable that the theme for the 2023 Africa Policy Week is putting people first.
Everybody. Welcome to our first plenary session, and today's session is titled Power, Policy, and People in Africa, Putting People First.
The first plenary on the Tuesday morning was really to set the scene. The objective was to introduce some of the themes that were going to come up during the week, but also to give enough foundational information that people who weren't familiar with the policy landscape in Africa or the drug use landscape, they would be able to understand that and get a grasp of it. So we had, for example, Gunnar from UNODC. He presented on the World drug report.
This year's World Drug Day theme was People First. Stop stigma and discrimination and strengthen prevention. Drug use continues to be high worldwide. 1 in every 17 people worldwide had used drug in 2021, 23% more than a decade earlier. The estimated number of users grew from 240 million in 2011 to 296 million in 2021.
I was highlighting the amount of people who are injecting drugs in the world and how much new drugs are coming into the market in the Africa region and how some of the drugs are also being consumed locally.
And you can also see significantly in East Africa, opioids is there, and in Southern Africa, also opioids is there, also in North Africa. And Western Central Africa, the bar is growing.
I think it is very, very important for us to understand the fact that people who use drugs, inject drugs, and the people who are in prisons are people. And they need human rights-oriented, evidence-informed, gender-sensitive programs which are advocated by the UN rules and regulations and policies everywhere.
In South Africa, how apartheid laws have been appropriated and used in the policing of drugs as well. And that this presents a tremendous problem to the country and in fact to the whole of Africa. The drug war and the war on drugs, which is actually a war on people, is battering whole communities and keeping them marginalized.
Here in South Africa, when we changed our constitution, it's now one of the most progressive in the world. When we changed our constitution, we didn't necessarily change our colonial mindset. So we adopted a lot of policies, a lot of laws that actually don't work for us, shouldn't work for us because they work in an American context or they work in a British context, but they certainly don't work in an African context.
I'm actually a South African, and the work that I do with Harm Reduction International includes overseeing the global state of harm reduction, which is our flagship report. It comes out every 2 years, and we monitor and track implementation of harm reduction services, such as provision of naloxone, opioid agonist therapy, and needle and syringe programs in every country around the world. And so that is the beauty of African Policy Week. A few years ago, it was only South African Drug Policy Week, but now it's African Drug Policy Week because more countries in the region have been invited. More countries in the region are actually starting to talk about this. This region is one of the regions in the world where they're actually starting to implement harm reduction in so many more countries than ever before.
Decriminalization is something we need to consider seriously as a continent, because so long as people are criminalized, they are not free to be able to access what you have put in place to support their lives. And we also need to engage with our governments. Our governments must begin to be participating in most of the conversations around drugs. Open, honest debates must take place in at our national level and at the regional level.
We can talk about how police are arresting people and how different governments really influence how South Africa, for example, guides or governs its society. We are not necessarily aware of the kind of power that drug prohibition has given to institutions.
South African context, apartheid continues to define the legislative and policy frameworks within which dependency on harmful drugs, on drug use, is managed by governments. When you look at sex workers, when you look at shack dwellers and informal settlements, and when you look at street traders, all these communities are criminalized.
It's worrying that we are pushing a lot of resources into these areas other than investing these resources in areas that can improve the lives of people whom we are, who are citizens, who are brothers and sisters. So there's need for us to begin to rethink our drug policies. We need to think outside the box and see what we can do around that to improve upon our drug policies.
Recognizing and working with the concept that we do not live in a normal society is central to improving our policies. The levels of poverty, inequality, and violence in our society is not normal. We have become numbed by the poverty all around us and accept it as normal.
The session on decriminalization regulation is one which is quite dear to my heart, and I get into a lot of trouble for it because the people in the reform world usually want you to be very positive about things like legal regulation, and that I'm much more conservative about it.
Well, I've been coming to every single policy week that has thus far been held. So, I mean, I think it's a very important venue for the engagement with a number of people in the sectors that you normally wouldn't engage with in your day-to-day work, to have those discussions which ultimately inform both policy within the drug sector, but also in other sectors, and where you find sort of the overlap and the nuance between the two and sort of begin contributing to both in a manner that is constructive.
So, cognitive liberty, stigma. We are inadvertently stigmatizing the largest part of the cannabis market while we are also extolling the economic benefits. It's called Cannabis in South Africa, the People's Plant, a full spectrum, not CBD, a full spectrum guide for policy reform. It's a guiding document. And in here is the system of DACA private clubs, the system of cooperatives.
Well, I'm here to talk about a few things. I spoke about the challenges of regulation of cannabis in Canada. Canada is one of only 3 legalized, regulated retail markets for recreational cannabis, and it's been so for 5 years. So in those 5 years, there have been a number of developments, and I think it's important to contribute those to the debate because no 2 countries are going to approach the subject the same. The other aspect of the work that I'm discussing is the importance of involving people who use drugs in research initiatives, program initiatives, and the issue of policy, drug policy design, implementation, evaluation, and to make sure that approaches to drug policy are incorporated in this particular way.
Sex is, if it's consensual, a very pleasurable act. And so then we found that we're in a situation where we've taken a pleasurable act and we've criminalized it simply because it's an exchange of services and now I take money for it.
We are pushing really for the full decriminalization of sex work, and I have to add the full part. And because we believe that the whole industry needs to be decriminalized, because what makes the industry so dangerous for those who are in it is that they're operating in a criminalized system. So you'll find sex workers that are assaulted or raped, or they have to endure so much violence, but they cannot really go to the police to report it because 1, if I have to state that I'm a sex worker, I will probably be arrested. And then 2, because of the stigma around sex workers and that belief that we are selling our bodies, then a lot of law enforcement feel like they're allowed to even perpetuate violence themselves. Sex work and people who use drugs, we face a lot of the same struggles. And so when we're able to exchange ideas in terms of, this particular challenge with law reform, this is how we address that challenge.
There were actually 3 panels in that discussion. It was quite intense with information. Really, there's a lot of information there that's very practical, that talks about the experiences and the hardships of communities in actually getting to where they are today and being relevant. Facilitated, of course, by Dr. Andrew Scheiber, who's been a tremendous champion for people who use drugs.
So I provide some technical advice, technical support, capacity building for a range of organizations working around drug policy and harm reduction. And I'm involved in trainings and to hear their experience and just support them to be leaders in the community in the response to the punitive approaches to drug use and the great hope and capacity and change that they can be. Also engaged in global fund processes on the country coordinating mechanism, and I'm a strong ally of people who use drugs.
Hi, I'm Aditya. I'm with the International Network of People Who Use Drugs. We're based in London, but I'm based in Indonesia. I've been to different events, but I don't think there are something similar to Africa Policy Week. It's quite unique. And I've been talking to other people as well, we need something this in other regions. This is a very good initiative.
The opportunities to take urgent and transformative action to rectify this unacceptable situation are there. Last year, Input developed this training module. It's a drug user-led technical assistance module, our rights, everybody's rights module, aiming at building the capacity of drug user-led networks and using the global AIDS targets, particularly the 10-10-10 and the 30-80-60, and linking them with international human rights obligations and treaties in their advocacy. Through collective action, we will fight to change existing local, national, regional, and international drug laws and formulate evidence-based drug policy that respects people's human rights and dignity instead of one fueled on moralism, stereotypes, and lies. Thank you.
And it's not just any other conference. The way it's set up is very engaging, it's very intimate, it's very interactive, and I think the key takeaway is that we need more like this in other regions. You know, I really want to have this in Asia, I really want to see this in Latin America, I really want to see this in many other regions. So I think this is an initiative that, you know, needs to be amplified more.
Policy Week is a very important initiative, and the chairman of the South African Network of People Who Use Drugs is also a co-founder of Africa Policy Week, and we are here as a support, one, but two is also to engage, to network, and also to talk about advocacy issues that are affecting people who use drugs.
So what is an advocacy roadmap? An advocacy roadmap is a roadmap to address advocacy issues related to global targets, decriminalization, and harm reduction in South Africa. The roadmap is intended to help networks and organizations to address the challenges at the national and local levels, empower community groups, and challenge government as duty bearers ultimately. It's intended to ensure that people who use drugs, their families and communities can realize their human rights and achieve health.
Session where we engaged on the advocacy issues that are affecting people who use drugs, but also we spoke about collaboration among other stakeholders and how we can ensure amplify collaboration.
We invited so many organizations, so we collaborated to make it work in South Africa and look at examples, like look at the road that Sisonke has gone so far to say, how can we learn from Sisonke decriminalization of sex work? How can we learn from other countries like Nigeria?
It's gonna take us some time to influence people. Like as we spoke today, that sensitization is not a once-off thing. And when I talk about sensitization, I mean getting people attitude changing towards putting people first. It is a struggle, it's going to take some time, and as I indicated that I'm involved in civil society forum, and we are trying to get the voices of people who use drugs, put them first, let them talk about their own issues, but that process on its own is still a struggle. We are in a situation where people who are using drugs are not involved in civil society, the sector is not formalized. So when time comes, we hope that things will change and people will start putting people first.
Today, we are going to hear more about additional services that are gender-centric and that meet the growing needs and challenges of women who use drugs in Africa.
So that's really an interesting session because I misinterpreted it initially. I thought it was about harm reduction, women accessing harm reduction services, but no, it was about the pioneering women who've taken a lead role in harm reduction in South Africa, who've stepped up and have worked with women who use drugs in rural areas.
I am Dimakato Nonyane. I'm a clinical associate. I started out working at a site, seeing patients, providing medical care for them. Then with a bit more experience and getting more familiar with the field, now I'm a training coordinator. I facilitate training for community-based organizations, students, undergrad students, and and healthcare providers in general.
We have great things and we've achieved so much. Of the 2,000 people who've gotten a chance to engage with OST, engage with other medical healthcare services and NSP, we have 10% of females who've gotten these opportunities. I've seen pregnant ladies get an opportunity to go through OST and give birth and really radically change their lives. But there's still more we can do.
I have to now see the bigger picture. As much as I can build people up, policies will keep putting them down. And that tension is something we need to address continuously. So this opportunity, at least this experience, has just made me realize the importance of addressing issues at a multidisciplinary levels.
So we've established those networks, we've linked those women directly to comprehensive healthcare services. We provided all the network leads with tablets, and we took them on technical training, and the next networks, the leads were democratically elected. The networks were taught about values and what do they want to look for in a leader. How do they want to be represented? Who's strong enough, even though they're so suppressed?
So the women who are engaged in harm reduction, they feel increased empowerment. They feel the autonomy, they feel they have the information, they feel the literacy, and they can actually tell you, yes, now I can take my child to the hospital. If that information is not there, she will not go to that access.
These are things that our women need. They are comprehensive harm reduction services, and we really need to be looking at how we can scale up what we're doing to offer these services.
Once you influence one woman, you're influencing families and generations. And that's why it's so important. With one person, the ripple effect, when it comes to women, it's easier. It's an easy win. And that's why women are so important.
Because I came across as strong but nurturing, I came across as bold but caring, and having this humble approach and a sense of understanding. My fight for people who use drugs and women in harm reduction came from this passion. I took this passion forward, I transferred it over to inspiring to achieve better for women that I worked with, but also for the women who use drugs.
So the final session will be talking about best practices. It came up continuously around issues of how does harm reduction look like within our context. It's different.
They spoke about the Belhaven Centre, which I'm very fortunate to be a director of, but Monique Marks and Michael Wilson have really driven that program.
So my name is Michael Wilson, and I'm one of the directors of the Belhaven Harm Reduction Center, which is based in Durban, and I'm really excited to be here at the Drug Policy Week.
I think whenever I come to a harm reduction conference, it really is a space not just to share and be inspired, but I think to dream, to vent, and also to be supported, because I think this work is really hard. And just as I was just sitting here, I was thinking about a couple of things. One was just looking at this, putting people first, and I really hope that we don't just say this, that this isn't just a slogan, but this becomes a lifestyle in our programs, in our reporting, in our advocacy. I am really humbled to be up here to present about Belhaven. There are a lot of people that also could be up here presenting about Belhaven. When I think about the last 3 years, there's the African proverb that says, it takes a village to raise a child. I think it's taken a village to start a harm reduction center.
It's very, very important that stakeholders come together during this Africa Policy Week. Why? Because Africa is a continent. We are many countries. There is what is happening in Botswana, what's happening in Kenya, South Africa. So the most important part is for us to come together to learn from one another. I've learned so much in this Africa Policy Week on what South Africa is doing. South Africa is moving very fast, and there's so much to learn from. So first is learning. 2 is exchanging, also sharing, like what we are also doing in our countries, and also is networking. Why networking? Because advocacy is not done in a vacuum. You do with partners, you do with allies. So it gives us the boost. The Africa Policy Week is not my first time to be here. It always gives me the boost to know all things are happening elsewhere, and we continue with the work we do. Yes.
we don't want people who use drugs to be in the street. But for a woman and a child, and the rape case stories, you won't even talk about them. They are so disheartening, they are extreme. It's like part of life. So if we are going to give services to women who are experiencing homelessness, let's start discussing just basic shelters. Actually, these shelters by this organization called Women Nest, they are in the same slums. You don't go and look for some posh estate. No, same slums. Just a room somewhere that they know when other people in the evening go to their home, I have a place I can go call home.
Drug Policy Week, Africa Policy Week, is a great initiative to bring together a variety of actors around this particular theme of what are the solutions? The current approaches aren't working. What can be done to improve the situation?
There's no silver bullet, there's no universal approach. Some of the structural elements are the same, but how you do it, completely different.
I think Africa Policy Week is a really important event. It brings together communities of people who use, organizations that work directly with people who use. I mean, if you want to know what's going on in a drug market, ask a person who uses drugs. If you want to know what substances are available, how they're being used, what harms are occurring, they're the ones who are going to know firsthand. And those are the ones that we should be listening to. They're the true experts. And to bring that knowledge to the table when it comes to the point of deciding what are we going to do about this.
So as I close, we need to continue engaging our community. We should not leave them behind, because knowledge deficit creates a perception that harm reduction is promoting. But once people understand what harm reduction is, they buy in easily. Thank you.
I think what I can say is yes, we're at the end of the week, but we're at the start of a new adventure. We're definitely at the start of a new story. This is not a case of people walking away from here saying, that was great, I'll forget about it until next year. We're already seeing that. It really is the first step in a lot of things happening.
Halala African Police Week, halala. Halala African Drug Police Week, halala.
What I have got from this conference is most certainly the fact that cannabis is a drug, and that I identify as a drug user, and that I identify very strongly with the challenges that we share with the rest of the people in the drug policy community. And thank you very much for sharing this time with us.
I emphasize that point that I've alluded to, the issues of reaching out, because the more people are empowered, the more we reach people, the more we send information, the more people they get liberated, because the only way you can be able to reach to them is when you empower them.
This was a wonderful and well-organized conference by Sanput, especially Sean. I've known Sean for a few years, but I really take out my hat for him for such a very informative, educational, empowering Africa Policy Week, especially on harm reduction, because harm reduction saves lives. And I appreciate everybody who's here who has committed to save lives of people in our country. And thank you to everybody for sharing their best practices. And we are committed. Let's work together. Let's meet again and ensure that we save lives. Thank you.
What I think I'm taking away from this conference is how important it is to get the message from out of this silo, which it sometimes seems, and to the general public, to the media, to bridge the divide between people and these communities.
There's need for us to begin to consider the indigenous people who have been growing these crops. How do we include them in this legitimate market that we are creating so that they also benefit? Because over years they have been criminalized, they have been considered illegal in terms of their activities. How can the Commission, through its work, include these indigenous people to benefit from these legitimate markets that are being created for cannabis?
For me, this was a mind-blowing experience because we really saw the people. I mean, we are from the cannabis industry where we represent the people's plant, and we've always seen it. But now, for the first time, we saw the people behind other drugs and other similar issues that we've got. And we really just realized that this is a human rights thing that we're dealing with. It's about people in the end, and this conference just really emphasized that for me, and that is what I'm taking home from it.
What I have learned from this commission is that I have learned to see people. Today, coming to the bus, going to the bus, coming here, a normal day, the same people that are there typically that I did not see. Today I saw them, and they had syringes and they had needles, and they were using, and their syringes were old. These were things that I did not see before coming here. So it has taught me to see the human being and not just see what society has taught me to see. Thank you.
A lot of awesome resources. There are a lot of amazing ideas, but we need to make it country specific. We need to put it into our country's context. We've got to be able to understand and have a general idea, but tweak it down a little bit so that we can make it ours.
I think another takeaway would be that in our programs there has to be, and there are examples of this, where there's a lot of flexibility in the programs, where you have aspects like research and evidence-based and collecting those numbers, which is great, but then we also need to have the humanity in it. So a simple thing of qualitative, quantitative. We have those numbers are useful, but we need to have stories behind them in order to get a more holistic picture.
It's good to see that there's a whole bunch of people working in this space, doing what you do, and I would just like to engage more with it and actually become more of a part of contributing to drug policy and making it more human rights based.
Africa needs to fund its government, harm reduction program. Africa needs to take care of its people. We are not going to wait for foreign aid anymore. It's time that we took care of our own.
Young people are not problems to be solved, but are problem solvers. And I believe it's about empowering those, those are our future generations. That's where it starts.
For us as social development, harm reduction goes beyond OST and NSP. It goes to sustainable livelihoods, which is what we are about as social development. We can't talk about OST to people who are hungry. In the past, we used to talk about ARVs, hoping that we give people ARVs as Department of Health, but these people are hungry. They are going to sell the ARVs to buy food. So what are you actually doing? Harm reduction is not a sideshow. It is integrated, just like we integrated HIV and GBV and placed GBV in Premier's offices. Let's make sure that the very GBV agendas in Premier's offices and the women's programs in Premier's offices include a component of harm reduction, and we are specific for which key populations.
We're not living with a drug problem, we're living with a societal problem. So we need to talk about the things we don't want to talk about. We need to know the people we don't want to know about. You said, somebody shared here about how they saw people for the first time. That's an incredibly powerful thing, to see somebody truly for what they are and not react in a way that humiliates them. Just to see them as another human being, no matter what's going on. We need to hear what we prefer not to hear. And what we try to do is we try to create a safe space for people to talk to people they would not otherwise not talk to, about the things they wouldn't otherwise talk about. And I'm quite happy, because in these conversations we get to understand what we don't know and who we don't know. And I specifically use the word conversations. These are not debates, they are not arguments, they are conversations. Nobody's trying to prove a point. And I think we've kind of achieved that, because when we hear the chairperson of the Central Drug Authority talking about decriminalization, which wouldn't have happened before, and that's not a reflection on your position before, it's a position of the Central Drug Authority's position before, that's encouraging. When I see a group of cannabis activists sitting downstairs talking to police from the narcotics division and having good, robust conversations, I'm really encouraged. But when I see a drug user sitting down and talking to the former president, I know the world is changing. I'm sorry. I know that we are eventually seeing the truth that people who use drugs, you can just put a full stop after the word people, because that's who they are. They are just people. And that goes for sex workers. It goes for every person here. We are, after all, just people. Fallibly human, but humanly lovable. We need compassion. And that's what I want to say to you all. When in doubt, when you are fighting a fight, stop fighting. Sit down and listen, talk, and understand we are all human. And all of us are just looking to live a life that's a little bit better. Make the difference in somebody's life, please. Thank you very much.
Ready, show some readiness. We are ready for 2030. We are ready. We are ready to change policies. I say, on your marks, get set. We are ready to change policies. I say, on your marks.